Hello.
Hi, good afternoon, Doc.
Hi.
Hi, my name is Fundile Nyati. Hello, Doc.
Hi.
Hi, Doc. How are you?
Good. How are you?
I'm good. I'm good.
Good. Sorry
We're
about that.
meeting online, and I've been looking forward to actually phoning your practice
Really?
to see if I can host you.
Oh, wow.
Last week, I was doing a search about you,
Oh,
and I wasn't sure. I wasn't sure whether you open or not, but I picked up that you open. Your practice is
yes.
in Glen. What's it now?
Hurlingham Manor.
Hellingham Manor. Yes, yes,
Yes.
yes.
Yeah.
yes.
No, we are open.
No, that's fine. No, but I
Yeah.
wanted. Well, I didn't have your numbers, so I wanted to do something. So we'll talk after this because
No
I
problem.
definitely want to talk to you
Okay.
about.
And you have my email now.
Now I've got your email, so I'll drop you an email, and we can
Cool.
then communicate.
All right. No
All
problem.
right. We've got about 6 minutes to go. I'm still waiting for the other guys.
Okay. I'm
I'll
gonna
just
unmute.
Huh?
I'll mute myself now. I will then come back on in a few minutes.
No problems, Doc.
Okay.
Sure.
Hi, Doc, can you hear me?
Yes, yes, loud and clear. Loud and
Okay.
clear. Where is the speaker?
She's connecting as we speak. I think she should be, I hope she doesn't have network issues, but she should be ready now. Let me double call her quickly.
We've got 3 minutes to go.
Yeah. Yeah, let me just call her. Okay.
I can see her coming through.
Okay. I don't see her, Doc. Do you see her?
No, I can see her. She's coming through.
Okay. Okay. And then Dr. Tseleng, is she connected? Yes.
She's here as well.
Okay.
Staleng.
Tlaleng. Dr.
Tlaleng.
Tlaleng. Or Dr. T.
Okay. Okay. Are we good to go?
Yeah. Yeah, but speaker needs a bit more light in front of her.
Okay.
Yeah.
I like that.
Agiri, you guys are the black swallows. Nkonjane mnyama.
And the yellow phones are at an advantage this time around.
Exactly. No, I think that one is better.
Is it better now?
Yeah.
Is it better?
Yes.
Okay, thanks, Doctor.
Yes.
We've got 1 minute to go. So, Sipho, I think you will take over to welcome and then introduce the speaker, and then we'll move from there. You introduce the speaker, introduce Dr. T. I'll just be in the panel. So the floor is yours to direct everything.
All right. Thank you very much, Doc, and good afternoon to everybody who's watching on all the different platforms. We thank you very much for joining us in this very important conversation around the issues that our nation is facing, the issues of COVID-19, and I think specifically today, our engagement with our panelists today, it's going to be centered around the issues of gender-based violence that we have seen in the country, that there's been an uprise of these issues of gender-based violence. And with us, this is a show put together for the Speaker of Council, Men Nongceba Molwele, who is with us at the moment. And I would like to take this opportunity to say welcome, Madam Speaker. Thank you very much for joining us.
Thank you very much. Thank you very
Madam
much.
Speaker. Okay, and then
Thank you very
also
much.
before.
And thank you very much for having us here, and welcome to the panelists, Dr. Mfokeng and Dr. Nyati. Thank you very much for making time to be in this panel.
Thank you.
Okay, thank you, Madam Speaker. Also with us on this conversation is Dr. Tlaleng Mofokeng Masiko, who is a Deputy Chairperson of the Sexual and Reproductive Justice Coalition of South Africa and runs a women's health practice in Johannesburg. She's also a health educator who produces video blogs about sexual and reproductive health and representing a regular sexual health radio show on Kaya FM. She's an author of numerous articles on health topics and has made several TV appearances, including as a host of 2 episodes on Al Jazeera's global health series, The Cure. And she's earned a medical degree from Nelson Mandela School of Medicine at the University of KZN. Good afternoon and welcome to you as well, madam. Thank you so much for joining us.
Thank you.
Thank you, ma'am. At this point, Madam Speaker, we thought maybe before we start with our broadcast, we could revert to the 2 issues that were raised in last week's broadcast. And I think it was the issues pertaining to Ward 130. The issues were really about the issues of delivery of food parcels by councillors and also poor people not receiving anything. Is there any feedback you would like to just give clarity on those particular issues before we get into our conversations, Madam Speaker?
Thank you very much, Sipho. Indeed, this is the second conversation we are having in this platform. And the last one was last week. And the issue you are raising about Ward 130, I remember the caller, the person who sent the message was Zach, his name. And Zach raised a concern about the distribution of food parcels in Ward 130 since they don't have a councillor there. we were supposed to go for by-elections. There is a directive that the leadership has put in place in terms of how to request food parcels for families that don't have a plate on their table. And that includes all wards. So the community leaders, as well as councillors, I guess in this instance, it will be a community leader, but also where there are no councillors, there are acting councillors. The chief whip of council deploys PR councillors or other councillors a councillor from other ward to act in a ward. So the directive that came, particularly from the Provincial Health Department's MEC, is that the councillors as well as leaders of the community can send an email. There's an email address that has been given to those people to request food parcels, but there's a template that is being filled to say, indeed, the Mulwele family, there's no one who's working there, and they do require food parcels. So the management of food parcels is actually taking place, particularly this week, because we have seen from other provinces as well that it has gone out of hand, where even people who don't even need food parcels, they still go and queue for food parcels. So the city is managing the issue of distribution of food parcels so that those food parcels go to the rightful people that they need to get.
Absolutely. And then just any feedback with regards to the water tankers, especially any feedback around communities that don't have access to water. What are some of the gains that the city might have made around making sure that our people have access to water as well?
Yes, that message of the water tankers was conveyed to the MEC for Environment, EISD, Infrastructure Services Department, Councillor Mpho Moerane, that there is this concern of the water tankers which are not arriving in these areas. And those areas, particularly in Ward 58, the issue around Mayfair, Brixton, those informal settlements there, they are being taken care of. So the department under MMC Moerane is looking, in fact, they are distributing water tankers to all the areas. And I am of the view that this week, all areas have received, because I have not received any follow-up complaint in that regard.
Okay, thank you very much, Madam Speaker. Thank you for clarifying those particular issues. If we can then start with our conversation today, and perhaps maybe, I don't know if you want to start with an opening statement around the issues of gender-based violence, Madam Speaker, and then we can then get everybody involved in this conversation around it.
Thank you very much. And I must thank Dr. Mofokeng for availing herself as a gender-based violence activist. We really appreciate your time, ma'am. And I'm hoping that the viewers of our platforms today will really benefit from the discussion of today. We thought of this topic today because gender-based violence has been a problem in the country as a whole for a long time now. Even the president of the country has actually raised an issue that we need to be very active in terms of the, in fact, it is a challenge that the country has, particularly in our city. We have seen women and children who have been killed in the past years and past months. We have seen even domestic violence because we have seen women who are staying in some relationships because they say they don't have resources, they don't have money, they can't take care of themselves, then they are forced to stay in some relationships, even if their rights are being violated because of their conditions of living. Yesterday, I was listening to Umama Mlambo Ngcuka, who was also talking about these issues on behalf of UN Women, that gender-based violence is a problem, particularly this time that the perpetrators or those who are violating the rights of women and children are now at home during the lockdown. So as a victim, you are staying with the perpetrator in one room, and now it might increase. So you might find that there are women who are being beaten and who are being abused, but there's nowhere that they can go because they are locked with these perpetrators. So we thought that let us tackle this topic of gender-based violence and see how best we can capacitate particularly women on how to face this period and how to deal with violence, with domestic violence, gender-based violence, but not only women. We know that, well, women are being violated in majority, but we know that even boys are being raped, boys are being killed, men at some point they are also being abused, but sometimes they are afraid to report the abusers because they are men, and our society has been orientated in a fashion that if you are a man, you can't be complaining that you are being abused, so you are not a man enough. So I think, and I'm hoping that today we will tackle this gender-based violence in all angles and say, as a society, what is it that we need to do now during the COVID-19 lockdown and beyond COVID-19, because it is indeed a societal problem.
Absolutely.
Yes, maybe
Thank you very much for...
Sipho, maybe before I leave the stage, let me also indicate that I am having another meeting which starts at 4, and my apologies. So when I asked to be excused from the meeting, Dr. Nyati and Dr. Mufokeng, please, Liskare, hey, Speaker Watella, we are busy, Rabu, more here. So, yeah, but my plea is that the purpose of this platform is for us to speak the language that all the citizens of Johannesburg would understand. Because sometimes we pitch these topics and these discussions at a very high level, and you find that we are not talking with the people who are affected by the situation, but we are talking amongst ourselves. Thank you very much.
Absolutely. Thank you, Madam Speaker. Dr. Tlaling, thank you very much for joining us once again. Madam Speaker has given us just an input around this issue. If you could maybe, how do you respond to some of the issues that she's raised, just to give us a context with regards to the issues that affect women, children, and even young boys? I mean, and even some men. I mean, what is the status of gender-based violence at the stage from your side?
Yeah. So thank you very much for the invitation. And today, just to confirm, I'm speaking as a commissioner from the Commission on Gender Equality. And I'll be speaking from, that side and the work that we do at the Commission. And, as per everyone, when the issue of the lockdown was gazetted on the 25th of March, the Ministry of Cooperative Governance and Traditional Affairs, it also listed the Commission on Gender Equality as an essential service over this time. And we know that with the CGE Act, our mandate is very clear. It's about being a catalyst for gender equality, but also looking specifically at the different vulnerabilities that society and the citizens, that we serve present with. And of course, the issues of gender-based violence are top of that list. We have been engaging, in the previous years in terms of research. We have issued investigative legal reports. Some of them from 2016, we're already calling for a national strategic plan around gender-based violence and resourcing of such a plan. But what's also important is that a lot of the work that we do is on the ground and in the provinces, and through our public education department, we do come across a lot of people who have complaints, who are themselves victims of gender-based violence, survivors, and some are living with a constant threat of violence. And what we know for sure is that even under normal circumstances, without a national disaster being declared, without a lockdown, services still don't reach every single person that needs them. And our concern currently as a commission is that when the lockdown happened, the assumption was that home is a safe space for everybody. And when the call was made that everyone stay home, you must stay, under lockdown situation with restricted mobility, we didn't think about the fact that some people will still need to be able to flee, unfortunately, from home. There are people, for example, who are still being discriminated against, who are still being alienated from their families because of their gender orientation. And we know that our shelters generally don't cater for people of a gender minority. And so under these conditions, we become even more worried about such individuals. Even if you think of the elderly, right? The fact that they are also at risk of abuse. Children are also at risk of being abused. And so when there is limitation of mobility, limitation of having access to a teacher or a school or a school friend or someone else outside of the home that you can share this with, what does it mean then for young people, for children who then need to verbalize that something is happening with them if they can't access a cell phone or a telephone? And so those are just some of the real concerns from the ground, just in terms of responding to the situation of GBV, but also how do citizens within their own homes able to actually deal with this issue? And it's very, very distressing, and it is a cause for a lot of anxiety.
Absolutely. Sure. You've covered quite a lot. Dr. Nyati, if I could also just ask you to join in just your input regarding some of the issues that both Dr. Tlaleng and Madam Speaker has really laid on the table for us. Your input, please.
All right. Look, my input is basically, I'm in agreement with, everything that Dr. Tlaleng has just mentioned. Maybe what I just need to add to the discussion is that South Africa has got a little bit of an advantage that we are getting, to this lockdown months after it has happened in other countries. That gives us a little bit of an experience of, some of the things we should be expecting here. Now, one of the things I came across as I was preparing for one of my interviews yesterday was that the whole pandemic and the related lockdown is actually a stressor on its own. The fact that people are going to be locked down, people are fearful of getting infected, people, during the lockdown, they are cooped up in their homes. And so one of the things I came across was that in a study that was done, they found that about 54% of people who participated, they said they experienced severe psychological impact. So just before anything happens, people are stressed by the fact that there is the lockdown, 54%. And then a third of the people also showed that they have got high anxiety levels, moderate to severe. So as we are sitting here today, it is no wonder that we are getting information from the ground in the communities that the levels of gender-based violence, the levels of domestic violence have actually gone up in the communities. And there are a number of reasons that, that is happening, but the underlying issue is that a majority of people are stressed. And that stress is creating a situation. And so we just heard a few days ago, a medical colleague actually was involved in domestic violence, and SAPS had to go and mediate. And when those police came to the premises, the doctor actually shot dead a policeman. What that says to me is that this has got no, level or class or race or whatever, So the point I'm trying to say is that kune problem in my communities. Whilst people are supposed to be safe, like Dr. Tlaleng said, but abanye abantu abakho safe with abantu abahlezi nabo. So it is important ke ukuthi sikhuluma ukuthi how do we help abantu? Where can they go to get help? Ma umuntu efila ukuthi his or her life is at danger. What should they be doing? So I'm basically in agreement with Doc, and I'm in agreement with the speaker. And I think this discussion should be talking around, we recognize there is a problem. It's an unintended consequence of the lockdown. What should be done? So yeah, those are my opening remarks.
Absolutely. Thank you very much for that, Doc. Madam Speaker, maybe from your side, you've heard both doctors giving us a perspective or how the situation on the ground looks like on our people. What should government be doing? Particularly, you are the speaker, so from the legislature side, what could be done to assist and mitigate against these issues that have been raised?
Yeah, I think Dr. Nyati says we need to discuss how do we deal with this unintended consequence. But I also want to say it's unintended and also unattended, because nobody is attending to this particular situation. We, at the beginning of the show, we talked about how do we attend to people who are hungry, to people who are indigent. But we are not talking about how do we attend to people who are faced with this kind of consequence during the lockdown or because of the lockdown regulations that we have put in place. So I'm not sure if I have an answer yet, but I'm glad that we have people like Dr. Mofokeng who are activists and in different platforms. But I think what needs to happen is that there are hotlines, there are lines where people, especially the victims, can call when they have problems. I think those lines need to be activated and be communicated to all the communities. If uhleli endlini and it is during the evening or it's during the night and you are observing lockdown, but you are being abused, this is how you should communicate. And I think also our law enforcement agencies who are patrolling right now to make sure that the laws of lockdown are being obeyed should also have that brief to say they must also be assisting those victims, because I would guess that they are always available on the street. So they should not only be looking at people who are violating the regulations of the lockdown, but also being able to attend to cases as a fananezi, the case that Dr. Nyati has alluded to right now, and other cases, maybe informal settlement, where a woman is being abused and uhleli uqhela ubalekela kwamakhelwane okanye ayolala kweminye imizi. So now because of the lockdown akakwazi ukubalekela anyway, then those people, I think there should be channels where the victims are able. Otherwise, by the time we end lockdown, people will be in a more stressful situation. and the psychological impact will be higher than it is right now.
Absolutely. Dr. Tlalenga, would you like to join in, just respond to Madam Speaker?
I think what's also important is to remember that the non-governmental organizations that used to plug in the gaps in terms of sheltering, in terms of first response, in terms of dignity packs, right? In terms of going with women to the police station to assist them as they open the cases. That support is also no longer there because those institutions, those organizations, most of them are led by women who are themselves survivors, are not listed as essential. And we know that even during a non-lockdown, a non-disaster situation, that it was already that much more difficult. So it's really, it's an urgent issue. Let me put it that way. It is an urgent issue. It's an ongoing, evolving issue. And we need to lobby and advocate, within the different spaces that we occupy. I'll give you an example of something that we were monitoring as a commission, because part of what we do is oversight and monitoring. And in a disaster situation, as it is for everybody, it's a different situation. That nothing is normal, about what's happening. And we didn't realize that a lot of women were complaining that they are about to give birth, that there are no baby clothes that are available in the stores. And, through the work of our chairperson and our CEO, we were able to intervene and be that catalyst and work together with the different ministries involved. And that's just one example of how something can be out of mind, out of sight. And yet for someone, it's such an important issue. And we did manage to at least get some laxity, at least relaxation in terms of baby products and definitely clothes. And so it's about how we can collaborate, I think, through different departments, through different ministries, and really decentralize the approach to COVID-19. We understand in terms of the biomedical approach, the health ministry is leading on this, but there's a lot of social support that the Ministry of Health, even under normal circumstances, is not in charge of. And so how do we make sure that the communities where the need is, where the hunger is, you cannot be hungry and observe lockdown. It's impossible because the need to eat is a real issue of survival, and when you think about the people who, again, the essential workers, so your health, your nurses, your doctors, your police people, ambulance, and emergency services people, those people are women too. So when they get home, it's not like ichaile. In the home, again, being the primary, caregiver and all of that. So it's very important. But also, I think as the city, we need to think about, or at least metropolitan, we need to think about the women who used to sell the fruit and vegetables in Kirk Street, the gogo who made magwinya. Those people were hustling for food for today, money today to buy breakfast for tomorrow. What has happened since lockdown? Because those people can't then provide for their families. And are we responsive quick enough? Because often when we talk about gender-based violence, we tend to think about physical abuse. But I want us to think about it more than just physical abuse of intimate partners. Gender-based violence encompasses all forms of abuse, financial abuse. We know how many people hide the chelete. Some people take other people's bank cards and confiscate them, So financial abuse is something that we know happens. The issue of child maintenance. Will courts be accessible for women whose partners will decide that they don't want to pay maintenance during this period because they don't tola guy, little kala guy. So those things are important because those are also violence. And yes, there's no intimate partner, but child abuse and child neglect is also a form of violence. And the fallout, always, ends up, unfortunately, disproportionately still affecting women. And so those are some of the other ways I think which we should approach the issue of violence. Look at the structural drivers, of violence. Look at the issues that even during lockdown become heightened. After lockdown, they will still exist. And so how do we envision the world, the country, our region, post-COVID, with the lessons we can learn from now? But coupled with that, there has to be an active arm that's reactive, because the needs are urgent. And the National Command Center, for example, has been inundated with calls for gender-based violence. The Commission on Gender Equality has a toll-free number as well. It's 0800 007 709. 0800 007 709. And this number people can call for any gender-related issue, right? I told about the child maintenance issues, but even sexual harassment in the workplace during lockdown. A lot of people who are essential services will still experience, violence in the workplace. And how do we assist them? The issue of course, sexual assault and rape, having access to transportation at night. We know public transport now has a curfew. What happens if I've been raped and it's after hours? How do I get to a hospital or a clinic, for assistance? And so those are some of the issues. So as much as we can do the long-term work of planning for a future, we need to react right now to the urgent needs and get to a place where we can preempt the trends and actually start being proactive.
Okay, no, I think, Doc, you've said a mouthful. I want to, maybe before Dr. Nyati, we can continue with the conversation. Maybe, Madam Speaker, I know you have to join that meeting at 4. So maybe you've got a minute to just respond, and then please attend to your meeting, and then we can continue with the conversations. I do see some input on Facebook, and then maybe we can continue on the other side. Madam Speaker, the floor is yours.
Thank you very much. Maybe if you can share some of the inputs so that maybe we are able also to attend to the inputs. But what makes me happy here is that the viewers who are listening to this conversation today, they do have the number that was provided by Dr. Mofokeng, the 0800 007 709, because some people don't know what to do, especially now because people are preoccupied about the disease, about the situation, and yet there are people who are really in need of such a service. And I agree to the support that needs to be given. In fact, we've been saying to our councillors as the representatives of the communities on the ground that issues like this, because they would maybe the first line of contact when such things happen, then they should also take up and support those victims that are being violated. And even now, my call is to say to the public representatives we have in our localities, we should take up the issues of gender-based violence seriously as part of the support. But I fully agree with Dr. Mofokeng that we need to look into this situation as well now during the lockdown and also beyond the lockdown. But the situation we find ourselves in now, where a person, you have to deal with the stress of this disease, of being infected, as well as the stress of being not having money to buy food as a woman, for example. But I want to congratulate the Minister of COGTA and the team for relaxing the law in terms of informal traders, where it was relaxed, I think, on the 2nd of this month, where the informal traders were allowed, especially those who are selling vegetables, that even if it's during lockdown, but you can still go and sell your vegetables there for you to have a plate of food. But for those who are not yet or who are not allowed to sell, you make an example of umama or ugogo othengisa amagwinya estradeni, and now because of the lockdown, ugogo can no longer be able to sell amagwinya during this period, lockdown. So what is it and how is the person being assisted? So again, we're encouraging our councillors to identify such houses so that they can also benefit, just ukuthi kulale kudliwe endlini, be part of the beneficiaries of the aid that is being given in terms of food security. But I understand that might not be enough, but I think the nation needs to discuss around. It's not an answer that should come from one person or one department, but it needs the nation, all of us as a collective, to say how best do we support these gender-based violence victims in whatever way that their rights are being violated.
Madam Speaker, thank you very much for your input, and thank you that through your office we're able to have these engagements, and that it will continue to inform and educate our people as per the Gazette. And I know that you're going to a regional working committee, and I'm sure you'll be able to raise these particular issues also there, so that the city is able to have an effort that is concerted to solving and helping and supporting women and children who are going through these challenges at the moment, Madam Speaker. Thank you.
Maybe before I leave, I see Dr. Nyati's hand. I think he wants to raise something.
I just wanted to just one question to the speaker. You know, you've got the council, then you've got wards. You know, you've got council, you've got regions, you've got the wards. There's some committees in the wards. Then there's what's called VDs, voting districts and stuff, and the structures that are closer to the people that could, you know, work closely with the councillor to quickly respond. You know, in the communities.
Yes, certainly, Dr. Nyati, it is like that. We have these structures you have mentioned, but at the center of the wards, a ward councillor works with the ward committee. Okay. So there are 10 members of the ward committee that works with the councillor as the advisory committee of the councillor, and also the line of interaction with the communities. And all of them, they have different roles that they are playing. So what the Office of the Speaker and the legislature is currently doing is to strengthen the role of ward committees. And I think during this time, the role of ward committees is very, very important. So what we are doing within the legislature is to strengthen those ward committee members to make sure that all of them are functional and in all the wards, so that at least we are able to, and people are able to reach out. If they can't find a councillor, at least they find a ward committee member who will then inform the councillor, for the councillor to inform council, and at the VD level. So, but what we have been also trying to do is to have street committees, because the VD is the voting district, which is a block. But if we want to bring issues and to be much closer to the people, we need to have the street committees in all our wards.
No, I'm answered, because I thought it is important to be as close as possible to where people live, so that the response can also be quicker, and where there are emergencies, then the link up with your central, you know, I don't know what you call it, but that is sitting in Braamfontein, can be quicker as well.
Yes, that's what we, thank you very much, Doctor. And we need also our people with expertise, our experts, people who are serving in these structures, like the structure that Dr. Mfokeng mentioned about POA, women activists, because the fact is they also reside within communities. So if at least we can be able to know them, okay, in this block, we have a Dr. Mofokeng who stays here. So how best we can use or utilize our expertise work and the experience in educating our communities, because I think knowledge is power.
Yes.
Absolutely. Madam Speaker, let us release you. We know that you need to run, but thank you for your contribution, Madam Speaker. We really appreciate it.
Thank you very much. I really appreciate it. Thank you very much to Dr. Mofokeng and Dr. Nyati. Thank you, Sipho.
Thank you, Madam Speaker. I've got some questions here to the two doctors. The first one comes from U Omopola. He says, my input in this issue is let everybody, when I say everybody, everybody's mothers, which is grassroots of gender-based violence, friends who will see this happening and not say anything. And I was somewhere in Marshalltown and I saw this guy beating up a lady who they said is his girlfriend, and I was trying to stop him, and his friends asked me not to do anything or they will fight with me. Everybody have to take responsibility. That's a comment from Omo. I don't know what your view is, both maybe Dr. Nyati.
Dr. T can take it.
Respond. Okay, Dr. T, okay.
Look, it's important, to talk about the fact that, crime in South Africa is not just crime, but there's a very elevated violence that's associated with that crime. And the fact that even men, bataba other men, like that's how bad it is, right?
Yeah.
And so often when people say, but why don't children speak up? Why don't women speak up? Speak up where if Luna self le atabana. You see?
Yeah.
So it speaks to the power and where power resides. And for as long as people can get away with beating other people in public spaces, in private spaces, if people can always claim ownership of children, women, each other, it means then we'll have a harder time to deal with the issues because there are no consequences. And the types of crimes and the rates of crimes are so bad now that if we come with any strategy, it has to be all arms, all at the same time. If we're doing prevention, it needs to happen at the same time as teaching children differently about gender and gender roles, bashimani habali, right? It means we need to do at the very same time, ensure that our police, our first responders are also sensitized to the issues and don't blame survivors and victims of violence for causing violence. We need an adult population that is willing to commit to the uncomfortable work of accepting that, in fact, some of us in society have power in our hands that's undue to us. And we are misusing that power to whoever we think is a minority. And we understand it very well with racial minorities and race. We need to have the same clarity and same understanding when it comes to issues of gender minority. We need to have the same understanding when you're talking about migration. A lot of our services in the metropolitan requires you to have a proof of residence. How many people are coming to Johannesburg to look for a place to reside and to work? And so if we're using that as a gatekeeping, how much is the system in itself not able to then be accessible for those who need it, right? As just one example of structural obstacles or obstructions that people may face. But the other issue is that we need to be able to respond and offer people post-trauma counseling and post-rape support, because those traumas live with you forever. And so unless we are learning how to live with each other, have a different type of emotional intelligence and integrity among communities within an individual, integrity is important. It will take us even longer because we are focusing on law enforcement and the courts, and they play a very important role in showing that even government doesn't take lightly the issue of violence. But we need to do everything else. We can't just only look to the court, but where there is a court case, where a case has been opened, the court must do the right thing. We can't then have magistrates and judges who are then making judgments contrary to the Sexual Offences Act, for example. So it will take everybody to play along. And it's everyone's problem. And we all have to commit our expertise. If we're good at children education, that's what we need to do, and let those people lead in that. And because then we know that our work is vast and it needs everybody all at the same time.
Absolutely. Dr. Nyati, you want to take a bit of an input also on this?
Yeah. Look, I think there's one issue that I did not address, what I wanted to address. I mean, earlier I talked about the stress levels that are high for everybody. But the other issue is about, I would say, substance abuse. Here we're talking alcohol, we're talking things like smoking, we're talking illicit drugs. Now, with the lockdown, those people who had stocked up were still then able to have access to alcohol. And we know that that is one of the drivers of the kind of thing we see in the homes. But there's also a different one, those who no longer have access to those things, who are now experiencing withdrawal symptoms, from alcohol, from smoking, and from whatever other drug that they are using. Now, those during the withdrawal symptoms, some of them, they become very irritable, and conflicts then come up triggered by the withdrawal symptoms. So I think without being seen to be making an excuse, but we also need to look at, how do those people get to be assisted? Obviously, the quickest way would have been for them to have access to the thing that they don't have access to, but then we're postponing a problem. So I think, like the number that was given by Doc earlier, for the CGE, hotline, numbers for SANCA, and other NGOs that are better funded, so that if you pick up that your partner or somebody in the family is becoming irritable, is becoming violent, and you know that it's linked to the fact that they are not getting access to what they normally use, then it's not a bad thing to actually, make a call to AA, to make a call to SANCA, to say, how do I deal with a situation like this? And if that doesn't help, obviously 10-111 before something happens. So I just wanted to highlight the fact that substance abuse or substance withdrawal can also be a driver to some of the abuse that we've seen, But in the broader scheme of things, we are hearing that there's less, violence that is landing people in hospitals, partly because of the lockdown and the fact that people don't have access to alcohol. What we are not hearing a lot, though, is the cases that are phoning, these places, like the CGE, to see how the numbers have actually performed since the lockdown. I'm sure that data is going to be available a little later, So I just wanted to bring the issue of substance abuse as something that is also a contributor to the whole problem.
Absolutely. Well said, Doc. Dr. Tlaleng, you're in, I think Doc raised quite a number of issues. And in fact, I'd made notes of the issues of substance abuse and the withdrawal symptoms that people are going through. Your take on it, have you seen a major change with regards to the spike going up of violence simply because people are facing this withdrawal symptoms? They no longer have that entertainment anymore.
Yeah. So it's still a bit early into the lockdown to really get, numbers that can show a trend, and so then we can make conclusions. But what we do know for sure is that, South Africans' health literacy is very low. So how umang mosebetsi wa hao ke eng kapa o rutehile ha kae, bongata ba rona ha re utlwisise hore na mmele ya rona e sebetsa jwang, ha re utlwisise di-sick tse re tshwarang hore na bohlokwa ba ho nwa dipilisi kapa ho tsamaya treatment e itseng ke o feng. And so hobane ha re na information, ha re kgone ho etsa diqeto kapa ho nka di-decisions that are best for us in the moment. It's almost like you always need someone else to be assisting you to make decisions because ha ona information. And the worrying thing with the lockdown is that there was only 2 days notice. And in that time, people did stock up. But the problem ke hore, there's other drugs that have always been under the radar. There have always been other drugs who are always banned, right? And not legal to sell. And so do we have an understanding of what is happening then with heroin, with cocaine, right? With all of those other drugs? Because when you need a high, you need a high. And you may be so desperate that you may want to get high on whatever substance there is. And because health literacy is quite low, people have who bona the symptoms of withdrawal. People are not able to see the symptoms, you know, of some emotional or mood disorders. And I've had to deal with a lot of young people, especially online, who are saying, I was due to go for my medication, but I'm now out of stock and I can't get to the clinic anymore. So there's many other factors around health, healthcare, drug use, intoxication. And I do think a lot of it, you know, we do need to ask assistance, even where, you know, in terms of medicine and the biomedical stuff, people who are sociologists, they can give us a lot of insights around intoxication, around patterns and what it is about the state of altering one's consciousness and mind. And why do humans do that so much? It doesn't matter where you are in the world. One thing is common about all of us is that we all crave to alter our consciousness. And so unless we get to the root cause of understanding that, as opposed to wanting to police it or wanting to prohibit it or wanting to pass laws to make it down, we are creating other problems. And so we do need a more accessible rehabilitation centers that are accessible to the public, that are free to the public. And we know that a lot of NGOs who do deal with substance abuse and any rehabilitation programs are requiring large deposits of money for people before they can enter into a program. So we need to approach the issue of drugs and drug use and intoxication as a health issue. Yes, at some point when people break the law, when people get violent, it becomes a policing, a justice system issue. But fundamentally, the use of drugs and the issue of rehabilitation, drug withdrawals or cessation is a health problem. And we need to deal with it as a health problem, as a socio-economical problem, as a psychological problem, and offer holistic care so that we can avoid and prevent issues where people are then in the arms of the law or the justice system when they actually have a medical problem that they're going through.
Absolutely, well said there, Doc. I've got just I think about 3 or 4 more comments. Dr. Nyathi, do we have about 10 minutes left before our broadcast? Okay, so I want to read the questions and then let's try and cover them within 10 minutes. The first one, Queen Rabutapi says, it's a huge crisis. I have been getting a high volume of calls, Facebook inboxes, WhatsApp, women needing help. I have been counseling them. Some had to call the police with little resources. I have to call them daily to make sure that they are safe. On other instances, parents reported to being abusing their children, taking out the frustration on them, especially the lack of finances and food being so highly expensive. That's from Queen. And in fact, Queen has been helping quite a number of women. She's been sharing information with me regarding some of the issues that have been brought to her attention. And she also goes on to say, I'm also working on many campaigns of human trafficking and child abduction as an activist, and I have to calm the parents of those children. I'm working on their cases that are missing. For me, working on these type of challenges is difficult, working from home and helping these families facing these issues. Those are her comments. Elias also joins in the conversation. He says, yes, the street committees will assist a lot, Speaker, because some wards are very big. And I think Speaker has covered on that. Then Sizwe says, even that indaba yabantu ayingeno indaba zabantu abayi-2 ayingeno, stigma contributes a lot. We need to work together as a community to solving these issues. And then the last one almost says, my question is about those people who will still take advantage of the issue and lie because he or she wants to punish that person. Please let one of the speakers answer this one. So those are the questions.
Dr. T.
Yeah.
Dr. T.
Yeah. So, I mean, look, the statistics, in fact, point to the opposite. What it takes for someone to leave their house, open a police case, sit through the entire process, secondary victimization happens all the time, and it's reported and recorded as such, all the way up to the courting system. Research has shown us that, in fact, that is not true. People don't just sit and think, I'm just going to do this, and there's like all these high numbers where this happens. We know the issues around families and what is said sometimes, but if you are being abused, you need to report and let the law investigate and take its course. If you think you are being unfairly treated, you also need to go and open a case of abuse and say that this has happened to me. It's important to remember that police and the courts are not the only two options. A lot of programs talk about counseling and therapy very early on. And there may be a real need to help a family in crisis, because often when we think of gender-based violence, we think of a victim of abuse, a weak person. We don't consider the family is in crisis. And yes, there may be other dynamics that do need to be looked at, but you cannot beat someone up and say, well, they were provoking me and therefore I beat them. That can never hold. And then say, but how if you know, that type of thing. Even the cases that are taken to court, it's less than 10% that ever get convicted. So the stats are showing us that, in fact, even where there is real violence, the courts still don't bring the necessary justice to survivors. So let's not spend too much time on minute and hypothetical situations. But maybe before we cut off, let me give you guys some other numbers. The GBV Command Center, it's 0800 428 428. You can also dial *120 *7867#. That will take you to the GBV Command Center. If you're a person with
Say that again, please.
*120 *7867#. 0800 428 428. And if you are a person with disabilities, you can SMS HELP to 31531. SMS HELP to 31531. And we know the child line one, but let's just repeat it in case there are children. 0800 055 555. 0800 055 555. And people can utilize those numbers in the meantime. And I really identify with one of the comments of the lady saying, even during this time as an individual, she's helping a lot. And, the risk of burnout and anxiety and really feeling helpless is a real one for a lot of people who are used to being in the front lines, who are used to just quickly reacting and going to help, tusang. And now when you are non-essential and yet the people are still calling you, the people still find you online. I think we need to think of the people who are caring for the carer, who's caring for the activists, who's caring for the women who are still using their own money, the little that they have, to spread around with other survivors. Otherwise, even they are at risk of being broken themselves. And then we would lose out completely because no one is taking care of the heroes. And this, I think, for me, is where we need to think about more collaboration, with the city, with the metropolitan, with the council, to really spearhead a new type of a system, a new type of a heart, that moves the city, and really put people first. And if we can all commit to that, I think we'll get a long way. And just to thank everybody, who continues to be available and to be assisting survivors. It is really hard to be isolated from people at this time.
Thank you very much. Dr. Nyati, maybe your closing comments. We've got 3 minutes left.
Yeah. Look, for me, I think I'm very happy the fact that Doc has actually provided a number of, hotlines, numbers that people can use for Childline, Lifeline, GBV command. I think people must use those numbers. That's the one thing out of this thing is those numbers are, it's a matter of difference between life and death type of thing. It's very, very important. Sis Queen, who is obviously doing so much, I think a Department of Social Development at national and also at provincial level needs to support her with resources for her to do more. Obviously, when I say do more, she can also be able to get other people to assist her, supported by DSD. So my proposition would be that through the office of the speaker, she gets linked with a relevant unit of DSD to be able to help her with a bit more capacity to do the work that she obviously is doing very, very well. There's a comment by Dr. T about a type of mindset that needs to take place at community level, and this is in link with Indaba Yabantu Ayingenwa. We really need a different way of, some time ago, we used to say one must be his brother's keeper, his sister's keeper, and we're not talking about just people you are biologically, linked with, but you saw, if you see a lady or a child being abused in any way, you would risk your life to actually make sure that that is stopped. So this idea that, again, it needs to go, let's go back to the original Ubuntu. You become a blessing to another person. So I think, yes, there's always a risk when you intervene, but sometimes that intervention can actually save somebody's life. So I don't think it happens all the time that, by intervening, you become a victim yourself. So let's take a risk to save those who are actually vulnerable. So I think those are my closing comments. And yeah, I think those are my closing comments. I don't have anything more to say.
Thank you very much, Dr. Nyati. Dr. Tlaleng, thank you very much. Unless you have anything else to add in terms of closing comments, please, you have this,
I think she needs to.
minutes,
I think she needs to wrap up. She's got so much wealth of knowledge. Please give her time to wrap up.
Yeah, just to say that at the Commission on Gender Equality, we really committed to assisting all role players, in this issue and in this country. And so we are really excited and look forward to offering the assistance. You guys can reach out to us and we will really be willing to do that. We have a lot of reports that, age back 5 years now already. And just as recent as December 2019, some of the people from Johannesburg actually came to present in terms of the state of the shelters. So we can really be helpful, use us as a resource, and let's really, use all our energies and our expertise, to bring justice and to end all forms of oppression and violence in our communities. And everyone just stay locked down, stay home, so we can, get through this in one piece and alive. And thank you for the invitation.
Absolutely. Thank you very much for honoring the invite. Dr. Nyati, thank you very much to your assistance and your availability. And also, just from the bottom of my heart, thank you for your commitment, both of you, to helping our people. We do need more people like you. And Dr. T, as you said, who's caring for those heroes? And And I really appreciate people like you who are taking your time and resources to assist others. And let's continue to give back and help as many people as we can. We really appreciate your time. Dr. Nyati, tomorrow we're discussing mental illness. That should be an interesting topic. I mean, you touched briefly on it. So that's going to be exciting as well, just to understand the psyche of our people as well.
Yeah, we definitely will be, yes, we're inviting a clinical psychologist to be part of the discussion. And maybe if I get another one who's also passionate around those areas, because again, the more voices, the better, you know, the more voices, the better. So, but we'll confirm those overnight.
Okay, Dr. Tlaleng, the invite is out. If you are keen to join us, let me know or let us know, and then maybe you can join us again.
No problem. Okay. Thank you so much. Bye-bye.
Okay. Thank you, Dr.
Thank you. Thank you. Thank you to everybody who's watching. We really appreciate everybody for spending your data and watching these programs. And to Dr. Nyati, visionary indeed. Thank you very much for your time, sir.
Thank you.